All right, go ahead.
All right, thank you, everybody. It's great to be here. I'm honored that you have me for your group. This is my first time speaking to the group, so I'm really happy to be able to do this. And tonight we are talking about sleep, which I'm sure affects everybody in some capacity. So let's start by talking about what exactly sleep is. And the short answer to this question, let's see if we can get this slide to advance here, is we don't know. We don't actually know what sleep is or why we sleep. We just have ideas about it. And until about the 1950s, people thought that sleep was just a passive activity that was sort of marked by us doing nothing. We knew about dreams, and psychologists had been thinking about dreams and studying dreams and working on dreams for a while. But as far as like what sleep is and what the process of it looks like and the science behind it, it's a pretty new area of study. But we do know that it's something very important. We know that it's necessary. We know that we don't function well when deprived of sleep. And studies on animals actually show that if you deprive an animal of sleep for a long enough period of time, it will die. And this is true of us as well. We need sleep to be healthy. And we actually spend a third of our lives sleeping. So if you live to be 90, thinking about it this way, you'll have spent 30 years of your life sleeping. If you live to be 60, you'll have spent 20 years of your life sleeping. I was listening to somebody give a talk on sleep online while I was kind of gathering stuff together for this. And he was talking about, somebody who's celebrating a 60-year wedding anniversary is actually only celebrating a 40-year wedding anniversary because 20 of that was spent sleeping. So there wasn't too much to say about it, but it's a big part of our lives. So I said, we don't really know exactly why we sleep, but we have some ideas or hypotheses about it. And one is that it's used to clear away metabolites and toxins in the brain that we accumulate over the course of the day. We'll talk a little bit more about the metabolites as we go through the presentation here and how those influence sleep. But our brains are working very hard during the day. The neurons are firing, they're using up glucose, they're engaging in cellular respiration and the metabolism of everything that makes the brain and the neural system work. And as we do that, we accumulate byproducts of that. And as that energy courses through the system, it creates damage to the cells. So some ideas about why we sleep is it gives us an opportunity to clear away all those metabolites and toxins that accumulate during the day and kind of clear the decks so that we can start fresh the next day. And it enables us to restore energy reserves. As I said, we're using up a lot of glucose whenever our neurons are firing, and we need to replenish those reserves, stop at the gas station at night so that we have more gas to use up in our brains during the course of the next day. As children, it helps us grow. So we do a lot of our growth during sleep, and there's science behind this. But our need for sleep and how we sleep changes as we age. We'll talk a little bit more about that too. Another thing that sleep is very important for is for consolidating memories and learning. Most of the process of learning happens with the neurotransmitter acetylcholine in our temporal lobes, and this happens while we sleep. So if we're not sleeping well, we're not doing a great job of consolidating our memories or learning all the information that we've accumulated throughout the day. So it's really important for that. And we know through our own experience that sleep is important because if we're lacking sleep, we experience some difficulties. And we've all, at least at some point in our lives, had poor nights sleeping. Those struggling with cancer definitely know the struggle with sleep difficulty. And some problems we have whenever we sleep poorly are we have concentration difficulty. So we're not able to think as clearly, as quickly, as efficiently. We're all kind of walking around in a fog from not having enough sleep. We're fatigued, so we feel tired. We have problems with memory and learning for the reason that I stated earlier. We need that sleep in order to consolidate those memories. And we can experience chronic health problems. And some of these health problems include obesity, high blood pressure, heart disease, elevated risk of stroke, and almost all mood, anxiety, and mental health problems accompany some sleep problem with them. But I thought it might be nice to pause here for a moment to talk about the relationship between sleep and cancer, because in my own practice working with cancer patients, I hear a lot of anxious thoughts about their inability to sleep and past problems with sleep somehow contributing to their cancer, because there's this idea out there that if we're not getting sleep, it's resulting in cancer. And I just wanted to pause here to tell you that the research on this is actually pretty mixed and pretty inconclusive. So there's some association between sleep and cancer in the research. Colon cancer, lymphoma, head and neck cancers, bladder cancers, thyroid and stomach cancers. There are associations, but they're not direct associations. So it's not thought that sleep problems actually cause these types of cancers. But actually for most types of cancers, there really aren't causal inferences or direct associations between most types of cancer. The way that sleep is most prominently tied to cancer is that if you have cancer, you have trouble sleeping. So this is the big thing to continue studying and to find good treatments for, and what I hope to help you at least in part with today. So some of you may know that there are different stages of sleep. There are actually 4 stages. And the first one is stage 1. We can break these stages down into 2 main stages. So there's what's called REM sleep and what's called non-REM sleep. And REM sleep is an acronym, REM. It stands for rapid eye movement sleep. So if somebody's in REM sleep and we were to walk up to them and lift their eyelid, we would see their eyes darting back and forth. So this is how we designate REM sleep. Rapid eye movement sleep is just a name that describes what's going on. And then the other stages are what's called non-REM sleep. And then the first one is stage 1. So this is the transition period between when we're awake and when we're going to sleep. That lasts about 5 to 10 minutes. And this is when we start to see physiological changes as we transition from wakefulness to sleepiness. So our heart rate slows down, our breathing begins to slow down, our eye movements slow, and our muscles tend to start to relax. As we move to stage 2, this continues. Everything continues to slow down, but now our body temperature is starting to drop, and we're getting brainwave changes that are associated with sleep. And this lasts about 20 minutes. So with these first 2 stages of sleep, we see these initial body changes. This is important for the relaxation we're going to do later, because we can actually try to influence or create an atmosphere that's conducive to sleep by purposefully doing activities that slow down our respiration rate, slow down our heart rate, relax the muscles. And when we can go from a hot environment to a cool environment, this is kind of stimulating what we do in stage 2 as the body temperature drops. So if you've had this experience of walking into the house on a hot day, from the hot outdoors into the air conditioning, you kind of feel sleepy. And that's because the body is used to falling asleep when the body temperature drops. We can get the same thing going when we take a hot bath or a shower at night. We go from this warm environment to the cool environment of our room, and we can feel sleepy. So these are important things to note and to remember as you're trying to manage sleep as best you can. Stage 3 sleep is our deepest stage of sleep, and this is what we need to feel well rested the next day. And this is why it's important for us to establish a continuous period of sleep, because we have to go through stage 1 and stage 2 in order to get to stage 3. And as you know, stage 1 takes 5 to 10 minutes, stage 2 takes 20 minutes. So if we're just catnapping throughout the day or our sleep is continually interrupted, we're not getting to that deeper stage 3 period of sleep where we really get the restorative sleep that we need. And the last stage is REM sleep. So this is the one I mentioned before, the rapid eye movement sleep. This is where the brain actually becomes more active. This is where most of dreaming occurs. So if you wake during REM sleep, this is when we have the tendency to remember our dreams. And we cycle through all 4 of these stages throughout the night. We don't just move from stage 1 to stage 4. We go 1, 2, 3, 4, 1, 2, 3, 4, 1, 2, 3, 4, 1, 2, 3, 4. And we tend to get deeper sleep and more REM sleep earlier in the night as opposed to later in the night as we start to transition more to the wakeful period. So our sleep is regulated by internal factors and external factors. And in order to sleep well, we need to get all of these factors working in harmony. So the first one are our circadian rhythms. Many of you may have heard about those. We'll talk about those in a moment. This is something that happens internally within the body, and it's regulated by light and chemicals. But we actually have 2 sleep clocks. We've got the circadian rhythm, which most people have heard about, but we've also got this clock called the homeostatic sleep drive. And I'll talk about that in a moment too. But we need both of those to be working well in order to get sleep going. Another important internal factor are our beliefs about sleep. So if we have negative beliefs about sleep, this is not conducive to sleep. So people who have insomnia tend to worry about getting to sleep, losing time during sleep. They think about problems that they're going to experience the next day because they haven't got good sleep, and that they're going to have problems with functioning. And so if you're thinking all these negative thoughts about sleep and you're lying awake in bed thinking these negative thoughts, chances are you're feeling anxious and you're not really going to get to sleep. So how we think about sleep is very important. Another really important internal factor is pain. So if we have uncontrolled pain, if we have chronic pain, if we have pain associated with cancer or any other bodily symptoms, that's keeping us awake. So pain management is an important part of getting good sleep. The second group are external factors. So these are environmental factors. These are things that for the most part, we tend to have more control of. So I want to spend time talking about that today. Where you're sleeping matters because some people are gifted sleepers. They can sleep anywhere. My dad's like that. We take bets on when he's going to fall asleep in his chair after Thanksgiving. I am not a gifted sleeper. I need to be in bed at a certain time with the covers a certain way. And if I'm not like that, I will not get a good night's sleep. And the other external factor are the sleep hygiene behaviors. And I know that Jen wanted me to talk about this today. So we call it sleep hygiene because these are ways of structuring your behavior and structuring your environment in ways that are clean for sleeping so that we're eliminating some of the clutter and the things that interfere with sleep. So talking about these internal rhythms, as I said, there's the circadian rhythm and there's the homeostatic sleep drive. Talk about the homeostatic drive first, because that's the one that people, it's usually new to them. And this is controlled by a chemical in the brain called adenosine. And adenosine is a byproduct of metabolism. So one of the purposes of sleep may be it clears out all the metabolites and toxins that the brain accumulates during the day through its work. And one of those is adenosine. So the longer we're awake, the more adenosine builds up in our system. So this is how the body keeps track of how long it is you've been awake. So you can think about the homeostatic sleep drive as that. It's the time that you've been awake. And this is affected by two things primarily, caffeine and naps. So caffeine and naps call back the homeostatic sleep drive. Caffeine works chemically because it's a stimulant, it's a psychoactive stimulant. It's the most popular drug on the planet. Many of us have used it at some point in our lives. Many of us are addicted to it. And the way it works to keep us awake is it blocks the impact of adenosine on the central nervous system. So although adenosine might be accumulating in our brain and it's kind of swimming around in there during the course of the day, if we drink caffeine, it blocks its effect. So this is how we stay awake. So if we drink caffeine at the wrong times or we drink too much caffeine, it's blocking the effect of adenosine, it's lowering the homeostatic sleep drive, and we're not able to sleep well. The other thing that affects it are naps. I'll talk more about this in a second, but because adenosine accumulates during the course of the day and it times how long it is since we have been asleep, if we take a nap, effectively what we're doing is we're wiping out all the adenosine that we've accumulated. It's going lower, and then we're thinking it's later in the day than it really is, and then it's pushing back the time that we're going to be able to fall asleep at night. The second internal rhythm is the circadian rhythm, and this is genetic. So as humans, we're supposed to be awake during the day and asleep at night. Our genes are programmed. Other animals like bats and owls, they have a circadian rhythm too, but it's programmed in the opposite direction. And this is controlled by a little piece of the brain called the suprachiasmatic nucleus, or this SCN. It's just this tiny little pea-sized part of the brain that keeps track of light that comes in through the optic nerve, and it stimulates the pineal gland to get this whole hormonal surge going that helps us to sleep. But we really need light in order to regulate our circadian rhythm. That's how it works. So as the day goes on and it becomes darker, this induces the production of melatonin, and the melatonin tells us to sleep. That's one of those hormones that gets going during that hormonal cascade. So this is why we experience jet lag. If you go to a different time zone, the light's different, your brain is still back where you were rather than the new place, and you're not sleeping correctly. And this is why melatonin can work, although people tend to use it the wrong way by taking too much or becoming too reliant upon it. The timing of the melatonin and how you use it matters. So we'll talk about that on this next slide here. So this is the two-process model of sleep, and it's both of those periods that I was talking about earlier. We've got the homeostatic drive and we've got the circadian alerting system. So you see here on the top, this is the homeostatic drive. And as the day goes on, we accumulate more and more adenosine. So these errors are getting bigger and bigger and bigger. And when it reaches its peak, we fall asleep. And then as we sleep, the adenosine is broken down by the body and there's less and less and less of it. And as we get less adenosine, then we get closer to the morning and wake time. At the bottom is our circadian rhythm, and it's regulated by light. And there's a delay in the circadian rhythm. So as we experience light throughout the day, the circadian rhythm stimulates the brain to be awake, and we get more and more light throughout the day. We're awake, we're awake, we're awake. And when this reaches its peak and the homeostatic drive reaches its peak, this stimulates the brain to go to sleep. So now the day is darker and we're starting to have our arrows decrease throughout the night. You can see there's a little mount here. As the light arrows decrease, the melatonin begins to rise and we get into deeper periods of sleep throughout the night. And then the melatonin starts to drop off and we get back to our wakeful period during the day. So I'll come back to this slide later to talk a little bit about why caffeine and naps and things interfere with this. But if you're using melatonin to try to regulate sleep, you want to be taking it right before bedtime. So this person's kind of trying to fall asleep at 10 o'clock in the evening. They'd be taking their melatonin maybe at 9:30 because there is this little delay between when the melatonin works and how it affects the circadian rhythm. And you just need a little bit. People think like more is better. If I'm not sleeping, I need more. But what you really need is the body to produce its own melatonin. So you just give it a little punch to try to get it going. And it's because it's working on the circadian rhythm pattern, it's not really inducing you to sleep because we've got this homeostatic sleep drive going along with their circadian rhythm pattern. It's just affecting the rhythm pattern. So melatonin is good to take for jet lag because your circadian rhythm is off, or because you shifted your sleep-wake time over the weekend because you're not working. So it's a good thing to take Sunday night to get back in the rhythm. But if you're having trouble sleeping on a Wednesday and all things being the same, it's probably not going to be all that effective. So how we sleep or how much we sleep depends on how we age. So we need more sleep when we're babies, and we have more of that deep sleep in the Rem sleep when we're babies and kids than we do as we get older. One of the reasons I wanted to show you this is because there's no magic number for how much sleep we're going to get. It differs for everybody. Some people might be fine with 6 hours. Some people might need 9 hours. It really depends. And you can see here in the adult range, the last 3 rows, we need about 7 to 9 hours. And as you're an older adult, you need 7 to 8 hours. You tend to need less sleep as you get into older adulthood because you're spending more time in those first 2 stages of sleep and less in the last 2 stages of sleep. And that's just a factor of how the brain is working and aging. It's just not working as efficiently. Plus, we've got all sorts of things waking us up as we get older. So bladder, pain, medications, illness, all of those negatively impact sleep. So this brings me to this slide, sleep interference. So these are all the things that interfere with sleep. The first are the negative beliefs about sleep. As I said before, if we have negative beliefs about sleep, it's not conducive to sleep and it's actually making the sleep problem worse. This is something a therapist can help with if you're struggling with that. The second one are poor environmental conditions. So if you're sleeping in a place that's too hot, it's too cold, there's a lot of light, there's a lot of noise, there's a lot of activity going on, that's not conducive to sleep. So that will interfere with it. The third are problematic learning and associations. So I know I talked about the circadian rhythm. I know I talked about the homeostatic sleep drive, but there's actually a lot of learning that goes into sleep as well, because sleep is a behavior. It's something that you do. And we learn how to sleep. It begins when we're babies, and we're constantly learning how to sleep throughout life. And some types of learning can interfere with sleep because we make the wrong kinds of associations. So if you're sitting up in bed and you're worrying about the next day, you're learning to be awake and anxious while you're in bed. And if you do this night after night after night, you're teaching your brain that being in bed at night, trying to sleep, means I'm going to be anxious and worried and thinking about the next day. So even the thought of going to sleep, or even going into your bedroom at night, makes you anxious. And that anxiety, it stimulates the fight or flight response. Your heart rate starts to increase. Your muscles start to tense. Your breathing starts to get rapid and shallow. And that's exactly the opposite of what happens in stage 1 of sleep and stage 2 of sleep. So you're actually teaching yourself to be up in bed rather than sleeping. And of course, we don't do this on purpose. We try to sleep, but when you work with a therapist, a lot of what you're doing is you're unlearning those maladaptive behaviors that are interfering with sleep. Other things are problems with those 2 drives we talked about before. So there's the interrupted homeostatic drive. It gets interrupted by caffeine because it blocks the effect of adenosine, and it gets interrupted by naps because it's clearing away the adenosine. And I'll show you this chart again. So if I can get my little pointer here, the adenosine builds up through the day. If you take a nap, it's like taking a scoop out, right? And you're starting from a lower level, then you got to work your way back up. You take another nap, you take a scoop out. And the same thing happens with caffeine. You're kind of like scooping it out, or you're blocking it. So it's interfering with this homeostatic drive, and you're not getting good sleep. The other problem are circadian rhythm disruptions. So this is what I talked about before with the jet lag, or differences in light. So, here in Pittsburgh, it's dark a lot of the time. It's dark in the winter at 5 o'clock. And we might feel tired at 5 because we're not getting a lot of light, and we might want to go to sleep early, but then we're up in the middle of the night because our circadian rhythm is not acting optimally. And of course, as we know, things that interfere with sleep big time are medications, illness, and pain. So insomnia is what we refer to as a sleep problem. So this is a persistent problem with being able to fall asleep or stay asleep that's gone on for months, and it's creating problems in your life because of concentration difficulty or fatigue. And it's a diagnosable condition. You can get treatment for it. So you might start by doing a sleep study with somebody in sleep medicine, where they will see what's going on in terms of your sleep and how you cycle through those 4 stages to test you for things like sleep apnea, which interferes with sleep, circadian rhythm disorders, and things like that. And the first line of defense for insomnia from a therapeutic perspective is cognitive behavioral therapy for insomnia, or we call it CBTI for short. And this is nice because it doesn't involve any medications and it targets what I've been talking about. So we start by giving you sleep education on how sleep works, sleep hygiene tips, so that you're creating a nice clean environment conducive to sleep, stimulus control strategies. So you're getting rid of things that are interfering with sleep. And sleep restriction and compression, which is something that's more advanced that you would do with a therapist, but it involves you tracking how you're sleeping through the nights, how much sleep you're getting, how efficient your sleep is, and actually restricting the sleep and trying to consolidate it into one solid period and then growing it out from there. Because one of the sleep hygiene practices, which I'll say is in a minute, is you only want to sleep as much as you need to. So if you only need to sleep 6 hours and you're trying to sleep 9 because you think that's the magic number, you think you have to catch up or make up for what you missed earlier in the week or years before, or you need to do that because you haven't been feeling well, it's impacting how you're thinking about sleep, it's impacting your behavior, and then you might be setting yourself up for failure. Another thing we do in CBTI is relaxation. So we'll do that today. And then, of course, there are medications for sleep. There are benzodiazepines, which have problems associated with them. They're addictive. They're not good for older people. They interact with other medications. This is not to say that you're bad. You know, if your doctor's prescribing them, talk with them. They may be helpful. I certainly work with people that use them effectively. But there are problems associated with them, which is why we kind of go to CBTI and some of these other strategies first. There's a class of drugs called Z drugs. Ambien's an example of that. And then there are over-the-counter drugs like melatonin. The thing with all medications is they tend to become less effective over time. And some of you may have experienced this. They might work for a while, and then their efficacy wears off or after time goes by, particularly with things like Z drugs. They'll work for a while, and then you're still having sleep problems. And really, that's because they stimulate sleep, but they're not addressing all of these behavioral issues that we've been discussing that might underlie it. So the best way to address this is to kind of hit both categories here. Change the behavioral issues, change the way you're thinking about sleep, and then maybe using medication as a tool in order to get back on track with that homeostatic sleep drive and those.
No, go ahead.
So sleep hygiene. So these are suggestions or things that we tell everybody to try to get good sleep. So as I said, sleep only as much as needed to feel rested. Have a routine wake-up time 7 days per week. Going back to that drive graph, we need consistent sleep times and wake times to keep that homeostatic drive and that circadian rhythm working together in a way that's effective. And if we're going to bed at different times and waking up at different times, we're dysregulating that, and it's kind of all over the place. You want to keep the bedroom comfortable and free from light and noise. You use the bedroom only for sleeping and for sex because of those associations and learning I was talking about earlier. If you're doing anything other than those two things in there, you're teaching your brain to do those things in the bedroom rather than to sleep. You want to avoid caffeine 4 to 6 hours before bedtime. Again, caffeine works on adenosine, but as a drug, caffeine has a very long half-life, which means it stays in the body for a long period of time. So you might drink caffeine. Some people are highly sensitive to it. They may drink caffeine at noon, and it's still impacting their system at 9 or 10 o'clock at night, still keeping them awake. So as a general rule of thumb, if you are drinking caffeine, try to avoid it 4 to 6 hours before you want to go to sleep. Nicotine is also a stimulant. Sometimes people think of it not as a stimulant because those who are addicted to it, when you have it, you kind of get that relaxed feeling, but it is a stimulant and it will keep you awake. So we want to avoid that at bedtime as much as possible. Fortunately, it's got a much shorter half-life than caffeine, so you don't have to wait the 4 to 6 hours, but try to space that out as much as you can. You also want to avoid alcohol after dinner. And although alcohol can have a calming effect because it's a central nervous system depressant that tends to make us feel relaxed, it also has sugar in it. So although it may have a calming effect whenever you first drink it, and it may stimulate sleep, you're putting sugar into your system, which your body then metabolizes, which then gets you, which then is stimulating later. So although it may help you to fall asleep, it's usually associated with restless sleep or poor sleep quality because of the metabolism of the sugar. We want to use sleep medication sparingly and as directed for the reasons I talked about before. Exercise is something that's very helpful, but we want to do that during the day and try to avoid it in the evening because that, of course, is stimulating too and increases your heart rate and your breathing rate. We definitely want to avoid napping. And, you know, if you remember one thing from this presentation and sleep hygiene, it's avoid napping. Because napping wipes out that adenosine and it really serves to dysregulate your sleep schedule. So when we do CBTI, one of the target behaviors we're looking to get rid of is napping. And this is a general directive that napping is maladaptive for sleep, but like anything else, this doesn't apply to everybody. Some people can nap just fine and it doesn't affect their sleep. And other people take a nap and it just really throws off their cycle. So you kind of have to know yourself. Eating a light snack at bedtime has been shown to be helpful, something that's preferably low in sugar because you don't want to increase your metabolism like you do with the alcohol, but something light. So cereal is something that's often suggested, a small bowl of cereal. You want to avoid excessive liquids, and this is because you want to try avoiding urination that wakes you up during the night. Do not try to fall asleep because if you try to seek sleep out, it will run from you. And this is because of the negative thoughts that we have about sleep. If you're trying to fall asleep and you're not, or you're watching the clock, or you're thinking about how long it's been since you've been lying in bed and how this is going to affect you the next day, this is really serving to keep you awake. And lastly, don't have worry time or wake time in bed because you're learning to be awake in bed. So if you're awake in bed or you're finding yourself anxious in bed, it is much better to get out of bed and go do something else than to stay in sleep, awake, and be worried or anxious. And people think, oh, I should stay in bed because then when my body wants to go to sleep, I'll be here. And you're actually shooting yourself in the foot because yes, eventually you will be in bed when you fall asleep. But in the meantime, you've accumulated all of this time where you're teaching your brain to be awake, and it's remembering that, and it's going to get you the next day and the next day and the next day. So it's better not to be in bed. And people say, well, if I'm in bed, I may not be sleeping, but at least I'm resting. And if you think about those 4 stages of sleep, yeah, you might be resting, but you're never really getting to stage 3 or stage 4 because you're not getting that good quality of sleep. And this is dysregulating your sleep cycle too. And this is something that a cognitive behavioral therapist who works on insomnia can help you with if you're struggling with that. So we can take a few minutes for questions and then we can do our relaxation exercise.
Would you mind taking your screen down?
Oh, wait, that's the wrong one. Let's see.
And I have some questions in the chat, that I can read. Some of them I asked me to read, and then we can ask people if they have any questions as well. The first one was, are Fitbits and other wearable devices good for tracking sleep?
Yes. Yeah, some of them have what's called an actigraph in them, and they do what's called actigraphy, where they track how much movement you've gone during the sleep. So that can help. I've never used that personally, so I don't have direct knowledge on it, but it can help you track how active or restless your sleep has been. And it can help you track when you're going to sleep. Because one thing you want to do when setting a bedtime is, say, I think I should go to bed at 9 and I've been going to bed at 9, but you may not actually be falling asleep until 11. And a Fitbit could help tell you that you're falling asleep at 11. So it makes more sense to go to bed at 11. Don't try to go to bed at 9 o'clock and spend that time in bed worrying, frustrated, teaching your body to be awake. Just go to bed at 11. That's when your body wants to go to sleep. And then you kind of roll back some of that negative learning. And then if you really want to go to bed at 9 for some reason, you can start to gradually take that back. So maybe go to bed at 11, and then the next week try to go to bed at 10:30, and then maybe 10:15, and then 10. Move it back gradually. Don't try to do it hard stop.
Okay, here's another question. Is it okay to use Benadryl as a sleep assist more than occasionally?
That's a question for your doctor. People certainly do that, yeah, as a sleep aid. Yeah, but it depends on the person.
Okay. And there was, I wake up about 15 minutes after I fall asleep. It's a marked difference from my normal routine. Should I be concerned about this?
Only if it's causing you problems. Remember that concerning yourself about it is probably going to make the problem worse, because then you're going to start to worry about it, and it's going to start to distress you. But if you're just waking up and you're not having problems, it may just go away on its own.
What do you think about medical marijuana for sleep?
Some people say it's a godsend. Other people have no effect on it. For some people, it actually makes them anxious. My experience in people working with medical marijuana is you have to work closely with a good provider who's going to titrate it in a way that works for you, because everybody is different. So it really depends on the individual, and sometimes it takes some trial and error, some experimentation with the prescriber for the type of marijuana, the dosage of marijuana, whether it's a tincture or not, and so forth. It's not something that I have strong opinions on, like yay or nay. It really depends.
So if I'm in bed and I cannot fall asleep, am I teaching myself to be awake? So I should get out of the bedroom and walk around.
Yeah, generally the rule of thumb is if you're not asleep in 10 to 15 minutes, you should get up and do something that's not overly stimulating. So I usually tell people, get up, find an armchair with a soft light, read a book, read the newspaper. You want to avoid screens because screens have light, which interferes with the circadian rhythm. So general rule of thumb for sleep hygiene is no screens an hour or two before bedtime. And that depends on how much the screens are affecting you. So some people are really affected by the screens and they need to cut it off at 2 hours and not look at them. And other people, an hour is fine, or for some people, the screens don't bother them at all.
Okay. Is chocolate included in caffeine concern?
Yeah, you want to avoid chocolate.
Yeah. What about using trazodone?
Yeah, that's something that's commonly prescribed for people with sleep problems. For some people, it's pretty effective, and for other people, not. It is something that tends to lose its effectiveness with time, like the other medications, but it's certainly a useful tool for some.
Okay, what about sleep mode on a Kindle reader? I guess that means that it's set to go off after a certain period of time.
Yeah, or there are certain modes on screens where you can reduce the brightness and the level of blue light, which can be helpful. Yeah. Dark mode, yeah.
Okay,
don't read in bed.
What's that?
Don't read in bed.
Okay, there's your answer to your question. How do I handle recent sleep issues that seem to be caused by a new drug? And I need to be on this drug for several years.
It probably depends on the drug. So for some of those drugs, the side effects will wear off over a week or so, and for other drugs not, and you'd have to talk with your doctor about that. Often they'll work with the timing of the drug. So if it's a drug that it doesn't matter when you take it and it's causing you to stay awake, they may change the timing, the administration to morning rather than evening, or vice versa.
That's a good idea. Does anybody else have any other questions? You could actually just unmute yourself and ask if you like. Nobody?
How much melatonin would you recommend?
Oh, that's a great question. I meant to look that up beforehand. I think that generally they come in, was it 20 milligrams? I always take the least amount possible. I'll take it sometimes on Sunday nights because they'll advertise those in pharmacies, as like high strength or like extra dose, and you just need the least amount possible.
The least amount. Okay. Yeah. Thank you.
There's another question in the chat. Any advice for aromatase inhibitors that cause sleep issues very often?
Oh, that's a good question. I don't know specifically for those. I'm sorry.
I know, basically how you answered it before. I know if people do switch the time of delivery, it does help in some cases, because it does, and a lot of times it's causing joint pain and things like that, which do make it difficult to sleep. So it's not even necessarily the actual sleep portion of it, but more the pain portion of it. And if you are in pain, and I mean, obviously you try to control it, but do you have any thoughts for how to manage sleep while you are in pain?
Yeah, therapists can help with this because pain's complex, and people tend to experience whole body pain. So it's not just the physical pain, but it's affecting you emotionally too. It's obviously affecting your sleep. So one problem associated with pain are those negative beliefs about it. Because if you're thinking about pain in a negative way, which we all tend to do when we first experience pain, that is anxiety provoking, it's distressing, and that keeps you up. Mindfulness meditation, starting a practice with mindfulness meditation is great. We don't have time to go into that today, but hopefully Dr. Davies will talk about that next week. I recommend Headspace as an app for all of my patients, whether they're struggling with pain or other types of distress, and setting up a practice with that. Headspace actually has a program for pain as a way of managing it. So that's managing it in a cognitive way, or how you're thinking about it. If you're involved in a clinic, they might make some behavioral suggestions. I know hot baths work well for people because it soothes the pain. If it's some sort of joint pain, or if it's some sort of skeletal muscular pain, that can be really helpful, both in that it relieves the pain, but also you're going from that hot environment to the cold environment, which tends to stimulate that transition into sleep.
And you talk a lot about, going to see a therapist. Is there a particular, like, I know you work at West Penn, but could they reach out to call you or are you just dealing with the patients on your floor?
No, they can call us. I'm sorry, I don't have the number. We have somebody who manages the health psychology service. I can get that to you if you want to give it to everybody. I'm sorry, I don't have.
That'd be great.
I'll look it up here if I can get my computer to come back up.
Oh no.
But what you want is somebody who practices cognitive behavior therapy for insomnia, and you can find that. You can find that online. I think the Sleep Foundation might have numbers for people who do that. There are people who are certified in CBTI. The certifying agency, if you go on their website, they have people. I'm trying to think of anybody else in Allegheny Health Network that does it.
Well, that's fantastic. I had no idea. I mean, I just didn't know what type of a therapist would do that. So it's CBTI.
Yes, CBTI.
Correct.
Yeah, and if you go to like a sleep medicine clinic, they should be able to refer people for CBTI too, whether you're
I don't know anything about a sleep medicine clinic. Where would you find one of those?
You'd probably need a referral from your PCP or your doctor to get a sleep study. UPMC has sleep medicine.
Oh, okay.
HN has sleep medicine. Yeah.
Oh, okay. I see what you said. See what you're saying. Okay. Does anybody else have any other questions before we put you to bed? Hopefully. No pressure there.
Okay, so no more questions?
It doesn't appear that way. So I am gonna mute myself. Oh, let me just ask. I just wanted to make sure before we because we'll just finish the call with the relaxation. We'll let you just turn your computers off and maybe just try to go to bed. I mean, it's a little early for that, but did anybody have any trouble that if you can even put it in the chat or just email me if you've had any trouble with entering exercise or having any issues like that? Is everybody okay with that? Okay. All right. Well, I will mute myself and you're ready to go.
Okay, so this is called progressive muscle relaxation. And I can send you a recording of it, Jen, too, so you can have it. You can give it to everybody. So what we want to do is get into a comfortable position. You can do this either sitting up or lying down. It doesn't matter, just as long as you're comfortable. And you can close your eyes, or if you feel more comfortable, you can just pick a spot to just keep a soft focus on. And we'll begin by sitting quietly for a few seconds, taking some slow, deep breaths. And now build up the tension in your lower arms by making fists with your hands and pulling up on your wrists. If your nails are long, press your fingers against your palms to make fists. Feel the tension through your lower arms, your wrists, your fingers, your knuckles, and your hands. Focus on that tension. Notice the sensation of pulling, of discomfort, and of tightness, and hold the tension there. You should feel tension, but it shouldn't be painful. So don't do anything painful. And now release the tension and let your hands and lower arms feel relaxed. Let them relax under the chair or bed with your palms facing down. Focus your attention on the sensation of relaxation in your hands and your arms. Feel the release from tension. Relax the muscles. And as you relax, breathe smoothly and slowly from your abdomen. Each time you exhale, think the word relax. Now build up the tension in your upper arms by pulling your arms in and back toward your sides. Feel the tension in the back of your arms and radiating up into your shoulders and back. Focus on the sensation of tension. Hold the tension. And now release your arms and let them relax. Focus on your upper arms and feel the difference compared with the tension. Your arms might feel heavy, warm, and relaxed. As you relax, breathe smoothly and slowly from your abdomen. Each time you exhale, think the word relax. Now build up the tension in your lower legs by flexing your feet and pulling your toes toward your upper body. Feel the tension as it spreads through your feet, your ankles, your shins, and calves. Focus on the tension spreading down the back of your leg, into your foot, under your foot, around your toes. Concentrate on that part of the body. Feel the tension. And now release the tension. Let your legs relax heavily onto the chair or bed. Feel the difference in the muscles as they relax. Feel the release from tension, the sense of comfort, and the warmth of heaviness of relaxation. As you breathe smoothly and slowly, think the word relax each time you exhale. Now build up the tension in your upper legs by pulling your knees together and lifting your legs off of the bed or chair. Focus on the tightness in your upper legs. Feel the pulling sensations from the hip down and notice the tension in your legs. Focus on that part of your body. Hold the tension. And now release the tension. Let your legs drop down heavily onto the chair or bed. Let the tension go away. Concentrate on the feeling of relaxation. Feel the difference in your legs. Focus on the feeling of comfort. And as you breathe smoothly and slowly, think the word relax each time you exhale. Now build up the tension in your stomach by pulling your stomach in toward your spine very tightly. Feel the tension, feel the tightness, and focus on that part of your body. And now let your stomach relax outward. Let it go further and further. Feel the sense of warmth circulating across your stomach. Feel the comfort of relaxation. As you breathe smoothly and slowly, think the word relax each time you exhale. Now build up the tension in your chest by taking a deep breath and holding it. Your chest is expanded and the muscles are stretched around it. Feel the tension in your chest and back. Hold your breath. And now slowly let the air escape and breathe normally, letting the air flow in and out smoothly and easily. Feel the difference as the muscles relax compared with the tension, and think the word relax each time you exhale. Imagine that your shoulders are on strings and are pulled up toward your ears. Feel the tension around your shoulders, radiating down into your back and up into your neck and the back of your head. Focus on this part of your body. Concentrate on the sensations around your neck and shoulders. And then let your shoulders droop. Relax and let them droop further and further. Feel the sense of relaxation around your neck and shoulders. Concentrate on the sensation of relaxation in this part of your body. As you breathe smoothly and slowly, think the word relax each time you exhale. Build up the tension around your neck by pressing the back of your neck toward the chair or bed, pulling your chin down toward your chest. Build up tension around your mouth, jaw, and throat by clenching your teeth and forcing the corners of your mouth into a forced smile. Feel the tightness and concentrate on the sensations. And then release the tension. Letting your head rest comfortably against the bed or chair. Letting your mouth drop open and the muscles around your throat and jaw relax. Concentrate on the difference in the sensation in that part of your body. As you breathe smoothly and slowly, think the word relax each time you exhale. Build up the tension around your eyes by squeezing your eyes tightly shut for a few seconds and then releasing. Let the tension around your eyes slide away. Feel the difference as the muscles relax. As you breathe smoothly and slowly, think the word relax each time you exhale. Build up the tension across your upper forehead by raising your eyebrows as high as you can. Feel the wrinkling and pulling sensations across your forehead and the top of your head. Hold the tension. And then relax, letting your eyebrows rest and the tension leave. Concentrate on the sensations of relaxation and feel the difference in comparison to tension. As you breathe smoothly and slowly, think the word relax each time you exhale. Now your whole body is feeling relaxed and comfortable. As you feel yourself becoming even more relaxed, Count from 1 to 5. 1, letting all of the tension leave your body. 2, sinking further and further into relaxation. 3, feeling more and more relaxed. 4, feeling very relaxed. 5, feeling deeply relaxed. As you spend a few minutes in this relaxed state, think about your breathing. Feel the cool air as you breathe in and the warm air as you breathe out. Your breathing is slow and regular. Every time you breathe out, think the word relax. Now count backward from 5, gradually feeling yourself become more alert and awake. 5, feeling more awake. 4, coming out of the relaxation. 3, feeling more alert. 2, opening your eyes. 1, sitting up. And that's progressive muscle relaxation. This works better if you do it every day. It's like a drill. It's like learning basketball layups or the violin. What you're doing is you're teaching yourself to relax. You're building muscle memory so that when you feel yourself tense, your mind recognizes the tension and it responds with relaxation. It's learning an adaptive behavior to help you relax.
This was excellent. Your presentation was fabulous, and this exercise was just amazing. I really appreciate all your time tonight, and you've taught me things. We've had many other sleep presenters, and I have to say the stuff that you presented, I had never heard. I didn't realize there was another component to circadian or I forget what the name of it. What's the name of the
homeostatic drive?
Yeah, I mean, so I've learned a tremendous amount. Thank you so much.
No, you're very welcome. Glad to help.
And there's a lot of compliments in the chat there.
Well, thank you for having me. I'm glad to be happy to come back and help any way I can.
Well, we'll be calling you.
Have a good night.
All right. Thank you so much.
Thank you.
I will email everybody and just let you know what the plan is for next week. But you're welcome to join us on Tuesday at noon and on Thursday at 5. And then I will tell you, so I know some people jumped on late. Next Sunday is the Super Bowl, so we are probably going to change the time of the call next week. And so I'm not sure what time it'll be, but we have Dr. William Davies, who will just talk about stress reduction. So it will be another excellent presentation, but it's going to be hard to top yours. So, well,
he's very good. He's been doing this for a lot.
Yeah, we are very, very excited to have tapped into this gold mine here. But so that was it, and we'll see everybody either Tuesday, Thursday, or Sunday. Thanks for joining us tonight.
Thank you.
Thank you.
Good night.